Now, when we look at other health concerns in the lives of people with ADHD by adulthood, we see that there's a growing risk that they're more likely to be overweight or obese, that they're more likely to binge eat or eat impulsively, and that this is particularly true in females, and that this can lead to not only binge eating, but eventually to a diagnosis of bulimia in upwards of 5 times as many girls with ADHD than is the case in the typical population. So eating problems start to become a significant difficulty by the adolescent and young adult years, particularly for being overweight or obese. People with ADHD, as we follow them up, are known to smoke more tobacco, to use more alcohol, to use more marijuana than other individuals, and all of those are associated with their own health consequences, leading us to, again, argue that ADHD is going to lead to some significant medical problems more than is the case in the general population. And among those difficulties, as I've mentioned, is a growing risk for coronary heart disease or cardiovascular disease, where we see that because of the increased smoking, increased alcohol use, poor diet, greater likelihood of obesity, all of those increase the likelihood that the individual may be subject to some kind of cardiovascular event, or again, have a shortened life expectancy because of these risks. And of course, everything I've mentioned would also increase the risk of cancer. We have not yet seen any research findings that show a greater risk of cancer in people with ADHD as they age, but then no longitudinal studies have gone on long enough to enter the age at which cancer starts to become increasingly likely, which is after the age of 50 to 60 in most countries. But one could argue that these risks might be elevated because of their lifestyle and behavior. So all of this is to say that ADHD may shorten the life expectancy of individuals who have the disorder, and may lead to a greater likelihood of earlier death. We've seen some findings now, not many, but some that suggest that this is likely to occur. Some studies show that children diagnosed with ADHD who grow up untreated are 3 times more likely to have died by the age of 46 than our typical children. Again, the percentages are still quite low, but nevertheless there is this elevated risk of early mortality. And we've also seen research in adulthood that has followed adults over time, showing at least twice the likelihood of dying within any given 4-year period, primarily because of the greater likelihood of accidental injury and driving difficulties as well. So there's a number of things that may be contributing to this shorter life expectancy, should it be found to exist, or at least should the current evidence that it does exist be replicated. And you can see at the bottom of this slide what those risk factors tend to be. So in general, I think what all of this means is that primary care providers, not just psychiatrists and psychologists, need to be aware that ADHD is linked to a number of medical difficulties and chronic disease and a greater likelihood of earlier death, and take this more seriously as far as treating the disorder and treating it at an earlier age than society is likely to do. Because our hope is that by addressing these various risk factors, that we can reduce these longer-term health consequences associated with the disorder.